Hi, fellow YouTuber who recently asked me a question after I commented on a video about my experience with electroconvulsive therapy, or ECT for depression. And yes, you didn't ask for a video. You just asked if I would be willing to say whether it was helpful for me by replying to your comment. But sort of unrelated to ECT, I struggle at times with putting all my thoughts together and focusing and just getting out a comment in a, because it's kind of like even though it's a yes or no question, it's kind of like a long answer sort of thing. And so, and for me, that relates to chronic pain, again, unrelated to ECT, and another health diagnosis called FND. And so I, and I didn't think you would be eager to agree to a like video call between just the two of us since you don't know me. So I thought I'll just make a short video and then post it and then and let you know about it. So in short, yes, definitely. ECT has been helpful for my depression. And I have done ECT. I started in 2020, and I've done it each year. So 2020, 2021, 2022, and continued in this year, 2023. So it's my fourth year. I've done, because I recently counted, so that's how I know, but 51 treatments over those 4 years, or procedures, treatment or procedure, whatever you want to refer to it as. And then to kind of like give a little background for me, I'm in my mid 30s. I live in the United States. I'm in a state in which I have healthcare coverage through Obamacare, and my healthcare is provided through Kaiser Permanente. So beyond paying like $35 per treatment for, because some of my chronic pain, or a lot of it, relates to everyday, usually severe migraine headache pain. I take the optional additional like migraine medication when I'm there at Kaiser receiving treatment. So I pay $35 for that. Otherwise, it's free for me. But a lot of my, besides medication, a lot of my mental health treatment is free, which is very good because I have financial problems, difficulty affording necessities. And yeah, and so depression for me started around probably age 15 or 16. So it's been 20 years. And for a long time, my depression just is, feels like it's most of the time. And I'm sure chronic pain plays a lot into that. So, like maybe out of a month, I feel like severely depressed and struggling with motivation, as opposed to just moderately depressed or lightly depressed, like half of that month or 2/3 of that month. So, and ECT, if you didn't know, here's some basics on that. And this information would be a little bit of research I did before doing it, or some research I did before doing it. And in the communication I've had with staff and doctors at Kaiser. So this would be through that lens. The I was offered the option of electroconvulsive therapy because I have failed many depression or treatments, medications for depression. Sorry, I'm trying to get my words out here. And so, and that's the medical term of failing. So I reached a threshold of like, you know, you can now be offered ECT because I had struggled so much, and I still struggle. But anyway, I'm trying to stay on one track before I move to another like related topic. So I was offered ECT. I am okay with medical procedures. I'm comfortable with that healthcare environment enough. And the idea of the side effects, the main one that gets recognized is memory issues. I also, when I was offered it, I've already, for the most part, had stopped working because of pain being disabling and depression being disabling. Like, I've not been able to find work that I can do consistently. So that factors into my decision. And yes, for me, how I've reacted or have experienced it, I have had some forgetfulness at times, or in my daily life, but I don't think it's just ECT. Like, and the cost benefit analysis, it's worth it to me. Like, I simplified it as, because I've struggled so much with suicidal ideation, I'd rather be forgetful than suicidal. And so I have some support in my life that can help me with the forgetfulness. Also, I tried to come up with strategies myself of how can I remember things, and in all different levels of detail, like, so I have to write things down more and whatever. But so chronic pain factors into me for forgetfulness in my belief, and also just depression to begin with can cause you to be a little more forgetful. So this third thing of ECT causing it as well, just, yeah. And depression is an illness, a disease, right? So it plays a big role in my life. So there's two different types of schedules of treatment. What you start with in the beginning is called an index treatment, and you would do treatment 3 times a week for, and I don't recall a number of weeks, maybe, I think it's like 1 to 2, 1 to 3, and then you do once a week for a similar amount of time. There's very much a set schedule to it that you normally don't adjust. And then it would be like, then you would go to like every other week, and then you would go to monthly, and then you do monthly for a while until you finish the schedule of treatment, and then either you stop doing treatment and just see how and they check in frequently. How is the treatment benefiting you? What side effects are you experiencing? And when I say they, I mean, for me, the director of the ECT program or department, and the psychiatrist who performs the treatment. And my paperwork has at times, or in the past, I don't know if it currently is the case, referred to that person as my surgeon, because it's like the default language for procedures when you get like paperwork, like saying your procedure is scheduled. And but no, it's not intrusive into your body. There's no it doesn't meet normal description of a surgeon. And so I'm doing a maintenance schedule, and I did start with an index schedule and then did maintenance originally, and then I think I've done index once more since then, I'm pretty sure. And I gotta sneeze, so let me. Okay, I'm back. Trying to do as little editing as possible in this video. So I'm currently on a maintenance schedule. I have, through this process, there have been times where I felt so much better, like after doing the first or second index schedule of treatment. And it was great and it was very helpful. But I have also come to realize, I would say more than a year ago, that for me, depression is going, I should no longer have the expectation that depression is going to go away. That I will have a point in life, like at age 40, I will have found the best treatment to, because like for me, it takes ECT and a depression med, and I need to start a second one. And so, like, I'll find the best equation to make depression just stay at bay, or never be more than mild for the rest of my life. And what I'm saying is, I no longer, I came to the realization that I should no longer have that expectation. So I'm just trying to live as best I can and be functional. And of course, pain plays a big role in that. Like, my mood is impacted by my pain. My pain can be impacted by my mood. So if I could easily, with my own life schedule, and you would need a ride to be picked up from ECT, then, and so the schedule of the person who is my normal ride, and the cost of gas to go to and fro, because the closest treatment for me is 45 minutes without traffic. And so that's a ways. And the time it takes from my ride's time at work, and their income is tied to my income, so to speak. So, like, if, and with chronic pain, it takes me maybe more than the average person, a little more time to recover. It takes like 2 days for me to fully recover from treatment. But like, so my point is, if I didn't have these barriers in place or these costs, I would do index treatment again, but it's more intensive, and I want to do it again, but I'm just not sure that right now is the right time, because like, I'm just going through this transition time in my life where things are feel more unsettled. So I'm doing treatment on a maintenance schedule. I have helped to choose what works best for me. So it has been once every 4 weeks or monthly, however you measure that. And then I think it's gonna move, based on prior conversations at my last month's appointment, to more like every 5, 6, 7 weeks, something like that. What is agreed upon between me and the and what the psychiatrist recommends, that doctor. And so I think that answers some of that question. Also, a decision that you would have to make for, and you can change it at any time, just as you can decide to stop treatment at any time, is whether or not you are having treatment on both sides of your head or just one side. So unilateral or bilateral. And if you didn't know, ECT involves you being put under, and this, I'm like don't cite me as your confirmed source of information. I'm just giving you a casual, like, through the lens of what I've experienced in my own language. So it could be imperfect. But an anesthesiologist is there. They put you under anesthesia for just 5 minutes, and you are given a seizure for just a moment of time, basically. They induce a seizure. That's what electroconvulsive therapy, how it works. And and so it's a controlled environment. You're in a procedure room, and it just happens for a short amount of time. And then you go to recovery and, slowly wake up as you naturally would from anesthesia. And then when you're feeling good and well enough, you get dressed. So you're in recovery, for less than 2 hours is, I think, my experience, but it's hard to know how long I was asleep for. But it is a short time. It's just and then you go home, and then you would come back the next time. This is an outpatient treatment. You're not kept at the hospital, for my experience, and I think is most people's experience. And yeah, so you would, and so if you have bilateral, both sides of your head done to cause the seizure, it is has the potential and the likelihood, based on research, to give you a better result as far as managing your depression. But one of the costs is that a higher chance of the side effect of forgetfulness. So if I'm doing it, for me, I just rather go full in on it, and, like, I'm not trying to balance it with, like, a full-time work job thing where I have to, like, where I'm trying to carry on aspects of my life. Like, my life is at a point where I'm just trying to, as I said before, just manage depression, manage other health symptoms, and just make do. I don't have a career that I'm, and children that I'm taking care of, for example. Okay, now I need to burp. Okay, excuse me. Sorry about that. Are there any other questions to answer? So, yes, I've chosen to do ECT long term. That probably puts me in the minority. Some people probably try it and feel like it didn't help enough, so they don't want to continue. I feel like it is helping, although I know that my depression can be better managed, as I already described how frequent it is, and when I say severe, like, I don't want to get out of bed and get dressed. So yes, I'm struggling in that regard currently, because for me, the index treatment effect lasted a long time, but it didn't last forever. So and so it's not unheard of to have periodic treatments, whether that be like the index schedule or the more casual or spread apart maintenance schedule. And with the maintenance schedule, as it has been explained to me, you're just maintaining a certain level of progress on managing your depression. And so I am still working on, as I have been for so long, trying to figure out what works best for me to best manage my depression, because with a variety of things, including depression, my body is just doesn't, and mind struggles to respond to treatment, like medication is what I mean. So yeah, so, and I didn't expect to continue medication when doing ECT, so that was one thing that was a surprise to me. Yeah, so, and as I said before, I'm doing a medication, and I want to start another one to try to, and continue ECT to just kind of try to help everything together. And what else needs to be said? So, as far as like, because ECT, and it used to be called shock therapy or shock treatment, has such a long history, and some of that history is people not being able, the patients not being able to give their full consent or any consent before being treated. Then there is a lot of consent that has been like built into the practice of it. And I'm saying like legally. Like, I don't know if it's at the federal level or just the state level, but I have to have ECT explained to me before I started in depth. I was given pretty sure it's just 2 pages, a 2 page consent document that I needed to have read and understand before signing, saying that I'm okay with doing this treatment. And then the doctor, like the psychiatrist, signs it. I think there's also a witness that signs it, and that has to be redone every 6 months. And the staff that are involved with this, there's definitely a legal cost to them, like the nurses, the people in anesthesia, the anyway, just for different levels of medical staff that helps in this treatment. I can tell because I see them check my consent documents before they want to make sure the consent is up to date. And so that's why it's just set on like an automatic, or not that's why, but so yeah, it's just set on like an automatic. Every 6 months it expires and you have to do it again, or I think that's the timing. And then and the doctor has to re-explain it to you to make sure that it's not assumed that you understand what you're doing. And then before that was to even happen, to be approved for it, my psychiatrist needed to approve me, and then a short appointment with a secondary psychiatrist, which, because of the pandemic, things are done remotely now, in my experience, for appointments for most time with mental health. So I had an approval from a secondary psychiatrist that I understood what was happening. My questions were answered. It was the right thing for me. And that expires and has to be redone, I think, yearly. And then I also had to meet with the head of the ECT department for my location. So he's like the head of the program, a nurse practitioner, so basically a doctor. And he interviewed me, and to make sure that it was the right thing. I don't remember how that interview went because it like was in 2019. And then I had to wait for an opportunity for the scheduling to be opened up, and then I was scheduled. And also, because you're experiencing anesthesia, another like detail to this procedure is it's stated that like, so someone, you have to have a designated driver to drive you home, so therefore you would probably have that designated driver take you there. And then someone should stay with you for, I think it's a few to several hours, and things like you need to be careful on the stairs, and not that, yeah. And anyway, so and not left alone just in case but that, like, that's just the base level precaution for someone who has experienced anesthesia, even though the experience was very short and limited. Okay, so this video is over 20 minutes now, and I was trying to be brief. I don't know if you could, because you basically only asked me one question. I don't know if I've answered all your questions. If you had other follow-up questions that you're hesitant to ask me because you didn't know how I would feel about sharing, I am open to it because I think more awareness is better. I didn't really know that before being offered ECT as an option that people were doing this. Since then, because I've mentioned it to people, like, hey, if I ask you your name a second time, that's because I have this experience. I am open to talking about it, and and therefore that can help raise awareness of that treatment and mental health problems. And I've met somebody who did experience ECT, so had a somewhat different experience than me, being in a psychiatric hospital in the 1960s, 70s. Not quite, I don't recall. But that's like the only person that I've interacted with that's had treatment, besides me. And so my point being, it's an uncommon procedure, but it's not. People might be ashamed or uncomfortable talking about it. So here's a person. Okay. All right. I'm going to let you go. Oops. I adjusted the... Sorry. Okay. I'm going to let you go. You can let me know if you have follow-up questions. That's fine. And let's see how much time on my end, how long video takes to upload to YouTube. Okay. Thank you for listening.